This is Dr. Stephen Widmer with Bloomington Orthopedics and Sports Medicine Service, and today we're going to be performing a right total knee replacement with robotic assistance. We'll use tourniquet today, so we are exsanguinating the knee using a S-mark bandage to get the blood out. We'll start by making a midline incision. This is a bovie cautery which helps us control bleeding during the surgery. Here we're making a standard medial parapatellar arthrotomy, which cuts through the tendon and allows us to move the patella off to the side. Everyone who has a total knee, we remove their ACL, and this is what we're doing here. We now put pins in the end of the thigh bone in order to help us with the robotics. My assistant will now put in pins in the shin bone as well, so that we know where these parts of the anatomy are in space. Once the pins are in, we put arrays on the pins, and we'll use those arrays to show the Mako computer where the bone is in the room, and that will then take the CT scan that is performed preoperatively and marry the two together to help us plan the surgery. Once we've registered the bones, we'll then verify that registration. And here we are showing the verification process. Once the femur is registered, we'll move on to the tibia. After registering the tibia, we'll remove the osteophytes or bone spurs. Once the bone spurs are removed, we will then stress the ligaments of the knee in both flexion and extension in order to develop a stable knee for the patient. Using the robotics allows us to understand how the soft tissues function as we build the knee. Once we have this information, we can begin balancing the knee. As you can see here, we'll make small adjustments, trying to get the knee to be equal in both flexion and extension based on the function of the patient's anatomy. Once we've settled in our plan, we'll begin cutting the bone using the robotics. As you can see, it's called robotic assistance. The robot keeps my saw in plane while I'm cutting the bone. If you can see closely on the bottom right, you'll see little green lines. If the saw attempts to go out of those green lines, it will stop. Or a more correct way of saying that is, if I try to push the saw beyond those green lines, it will stop, and that's a safety mechanism for the patient. As we cut away the bone, it gives us an idea of where we've completed the bone cuts and what still needs to be done. Once the bone cuts are complete, we then will remove the soft tissue that remains. This includes the meniscus, and this is a picture of the meniscus that we removed as well as the bone cuts that were removed from the knee. After this is completed, we'll use trials to help balance the knee. Once the trials are in, we will use the robotic information to help verify that the knee is completed appropriately, and any soft tissue releases will be made at this time. Here we're testing the function of the PCL. Once this is done, we'll finish the bone preparation for the final implants. Once the bone preparation is complete, the trowel components will be removed, and so will the arrays. This is a picture of the final implants that will go in. We irrigate out the knee first and control bleeding after the tourniquet is let down. This knee was done with press-fit implants. After the implants are in, we'll close the knee in a layer-wise fashion. That was the arthrotomy layer with the muscles and tendons. This is done with absorbable sutures. Then subcutaneous layer. And finally, the skin is closed with staples on this patient, and a silver dressing is placed. Compressive wrap is placed, and the patient will be then taken to the PACU for recovery. These are the final x-rays.